name is Margaret, and I'm here to present to you a video presentation on Miss Samone Walker, a 29-year female patient that I had the opportunity to interview as part of my signature assignment for course 642. Ms. Simone, a 29-year-old female, is seeking treatment for anxiety-related symptoms. She claims that during the past 6 months, she has struggled with constant anxiety, excessive worry, restlessness, difficulty concentrating, and other symptoms. Her informational background. So Ms. Simone is a software developer. She cites severe demands at her work, including the need to adhere to stringent deadlines and continually adopt new technologies. Her anxiety problems have been significantly exacerbated by the stress she experiences at work. She also admits that her mother has generalized anxiety disorder diagnosis. Her developmental history. Ms. Simone was raised by her parents and young sister in a tiny town. Her academic performance was great. She described herself as diligent and accountable, frequently taking on additional duties and having high standards. She has a few close friends, but because of her anxiety problems, she finds socializing harder and harder. History of education and employment. So Ms. Simone has a bachelor degree in computer science and has spent the last 8 years working in technology. She has constantly performed well throughout her career and has several promotions. However, her anxiety symptoms have been exacerbated by the pressure and responsibilities at work, which has prompted her to seek help. Her relationship history. She has been dating Sam for a considerable amount of time. She calls their bond encouraging, yet she feels bad for burdening him with her anxiety related problems. She admits that expressing her feelings and anxieties to him can be challenging because she worries about being judged or being misunderstood. Her medical and drug use history. Mr. Mann claims no severe physical health issues in her past, but due to her busy work schedule, she has a sedentary lifestyle. Yet, she understands that the need for regular exercise to reduce stress and anxiety. Semyon claims that she doesn't use drugs or alcohol. She occasionally drinks in a social setting, but doesn't use it as a coping method. Cognitive behavioral therapy. Cognitive behavioral therapy as a psychotherapy method aims to recognize and alter harmful thoughts and behavior patterns that contribute to anxiety disorders. According to Curtis et al. 2021, CBT tries to support people in creating better coping mechanisms and more adaptable beliefs. Motivational interview. Motivational interview entails organizing a group discussion to assist people in discovering their drives, ideals, and objectives. Motivational interviewing addresses ambivalence and resistance to change, and it can help people in recognizing and boosting their innate motivation to conquer anxiety and make the required adjustment, according to Costino et al. 2019. Another form of therapy is the psychodynamic psychotherapy. Psychodynamic psychotherapy examines unconscious processes, early life experiences, and relational patterns to understand the reason for emotional comfort, according to Buetel et al. 2019. By identifying and addressing unresolved conflicts, unmet needs, and unconscious anxieties that lead to anxiety symptoms, psychodynamic therapy can be beneficial for anxiety disorders. Utilizing several modalities. Combining the three modalities CBT, MI, psychodynamic psychotherapy, a thorough and all-encompassing approach to treat anxiety disorders can be achieved. People can identify and change thoughts and behaviors that contribute to anxiety with CBT. MI supports the person's um, ability to resolve to change by boosting motivation and resolving ambivalence. Anxiety deepens underlying causes and relational patterns are examined in psychodynamic therapy. Combining the methods allows psychologists to treat superficial symptoms and underlying psychological issues, producing a more thorough and successful therapy outcome. Therapy schedule sequence. The sequential method is reflected in the sequencing of the therapies CBT, MI, and psychodynamic therapy. Starting with CBT enables symptom reduction right away by focusing on dysfunctional attitudes and action. Next, MI can be used to increase motivation and participation in their therapeutic process, laying the groundwork for a more in-depth investigation. Last, psychodynamic therapy can be used to explore the underlying unconscious causes of anxiety, fostering long-term improvement and personal development. Supporting culture and diversity. Therapists need to be aware of cultural variations and modify their methods accordingly. This may involve speaking in a culturally appropriate way, being conscious of cultural customs and norms, and considering anxiety-related cultural issues. Therapists can also use cultural narratives and metaphors that connect with the client cultural identity to develop cultural understanding and inclusivity. So I'm going to segment 2, and segment 2 will involve my interview with Ms. Simone um, regarding her treatment. So now you're going to hear the voice of Ms. Simone as I ask her question. So Simone, I appreciate you sharing your psychological background today with me. Your anxiety problem appears to be caused by work stress and high standards. CBT can help you manage your anxiety. Would you like to proceed?
Yeah, I'll start. I desire better anxiety control.
Okay, so do you give me the permission to carry out this interview?
Yes, I do.
So great. CBT identifies and alters complicated thought processes and reduces anxiety through behavioral strategies. We will start with your work and stress beliefs first. The thought records, recognizing your nervous thoughts, considering their pros and cons, and creating more plausible counter arguments. So, ready to try it?
Yeah, okay.
Okay. Great. Take a stressful situation like a job deadline. Can you clarify?
Yeah, okay. Last week's deadline made me anxious to accomplish an assignment. My coworkers and employers would think I'm competent if I did it perfectly.
Great. Let's analyze this situation. What were you thinking?
I wanted perfection. Mistakes will ruin me. Everyone will judge me and ruin my career.
Thanks. Let's examine the pro and con argument. How could you know a mistake will have such a dire consequence?
I've made mistakes, but I don't think they've been disastrous. Errors have continued in my coworkers' careers.
Good realization. Now let's focus on more logical counter arguments. Given the information you just mentioned, what sensible and balanced viewpoint could replace your initial concerns?
Mistakes are okay is more sensible. It's a learning tool and doesn't affect my future success.
Excellent. Mr. Man, this shows how to change and address negative thinking and to reduce anxiety. Remember that our views can be biased and that facts can help us see things more objectively. We will discuss problem solving. Life pressure can create anxiety. We can identify problems and devise practical solutions. This could involve breaking problems into smaller, more manageable pieces, brainstorming solutions, and considering their pros and cons. By fixing challenges, you may regain control and reduce stress. We will monitor and adjust your treatment during our sessions. CBT require active engagement and practice outside of therapy sections. We will assign homework to help you apply the concepts we teach. So Simon counseling works best when you participate. I will help you handle your anxiety better. So now let's talk about the motivational interviewing for anxiety treatment. This will be our segment 3, okay? So motivational interviewing helps people discover and develop their desire to change. Discuss your value, goals, and reasons for coming down. This technique aims to give you a safe space to speak. Are you ready?
Yeah, I'm ready.
Okay. Let's discuss your values and priorities. What drives you?
Accomplishment, progress, and strong relationships. I want personal happiness and a great career.
Thank you. Let's see how your anxiety is affecting these values. How can worry affect success, personal growth, and healthy relationships?
My anxiety causes excessive concern and self doubt, making it hard to focus and work. It inhibits my ability to take risks and develop personally. I sometimes avoid social settings due to nervousness, which affects my relationships.
Hmm. Your worry may be hindering your priorities. So let's examine your motivations for anxiety control. What motivates you to reduce anxiety?
I want to control my emotions, increase work productivity, and be more present in my relationships. Anxiety shouldn't limit me anymore.
Important goals, Miss Simon. Imagine your existence before anxiety. How might managing anxiety change your life?
Controlling my anxiety would make my daily existence more secure and peaceful. Work helps me focus and balance life. I felt safe in social situations.
Miss Simon, that sounds fulfilling. Change makes people nervous. Instead of expecting instantaneous change, let's contemplate incremental but meaningful anxiety control. By breaking down the process, we can make it easier. We can also cooperate on strategies that fit your lifestyle.
That looks that approach looks more manageable.
Great. Motivational interviewing will help us discuss your belief, goals, and reasons for change during counseling. Remember that you are in charge and I'm only guiding you. We can develop a plan that helps you manage anxiety. Understanding how managing anxiety can enhance your life is vital. We can plan to overcome these problems and build resilience together. Next time, we will set achievable anxiety control goals. Values, motivations, and life goals will decide these goals. We will also discuss the reason and building a support network. Simeon, you showed courage by asking for help and demonstrating your willingness to address your concern. I will be with you as you make significant changes. So now we go to our segment 4, which is psychodynamic psychotherapy interview for treatment. Psychodynamic treatment covers underlying conflicts, unresolved emotions, and early life events that may cause anxiety. Understanding this fundamental can help you develop new perspective and coping techniques. Discuss your early relationship and experiences. Can you describe your childhood and your parents?
Yeah, okay. My parents, younger sister, and I lived in a little town. My mother was apprehensive, and my father often missed appointments due to work. She fretted over everything, including my grades. She demanded that I do well in school.
So your family values and meeting expectations that affected you.
I've always had to be perfect. I failed failure. I constantly tried to prove myself in school. Anxiety and pressure have always affected my career.
It senses how those early occurrences might shape your beliefs and actions. Let's talk about your workplace and anxiety. What an irritating job situation right now? What's an irritating job situation right now?
Yeah, so last month I had a deadline driven assignment. I panicked and was concerned about missing the deadline. My constant checking and rechecking hampered my productivity.
Work stress seems like childhood stress. Psychodynamic treatment links contemporary problems to unresolved past concerns. Are there any childhood situations that resemble your current work related anxieties?
I had a project graded lower than I expected. I felt guilty for disappointing my parents. I'm experiencing something like disappointment and fear about falling short.
It's fascinating how early circumstances can shape our mature emotions. Your childhood may taught you to fear rejection and condemnation. People pleasing and self neglecting may emerge from this anxiety inducing worry. We may improve relationship and self expression by recognizing these trends. We will. We may improve relationship and self-expression by recognizing this trend. Simeon, we will address these subjects and find links between your past and current worries in future meetings. A trusting and investigative therapeutic partnership will reveal your unconscious conflicts and sentiments that cause worry. This method lets us make long-term personal developmental strategies. So, Simeon, thanks. Early life and performance drive affect anxiety and relationship. Psychodynamic psychotherapy explores on the underlying conflicts and feelings. This helps us to understand how they cause your anxiety and make long term changes. Let's examine your relationship and anxiety. Are there any recurring issues in your closest relationships?
Yeah, whenever I made mistakes, my mom was unhappy and anxious. She seemed affected by my mistakes. I internalized this and developed a fear of failure, pushing myself to impossible standards.
Your mother's influence on success and anxiety makes sense. In your workplace, do any stressors or triggers aggravate your anxiety beside worrying that you won't meet expectations?
I'm afraid others won't do their work well. I must manage every aspect of the project, which makes me anxious.
Needing control and delegating can lead to worry about being evaluated or blamed for not fulfilling expectations. Perfectionism and control as coping mechanism often lead to these traits. We will study these trends and their reasons in future sections. By recognizing these unconscious tendencies, we may work together to change them because emotion indicates underlying tensions. We will also pay more attention to them. We will develop self-awareness and coping techniques. Simeon, understanding and change take time and effort. So I will be there for you even if it is upsetting. So now I will go to segment 5. According to the information given, Simeone, the patient responded favorably to the interview using CBT, motivational interview, and psychotherapy as treatment modalities. A thorough psychosocial history was taken at the beginning of the session to learn as much as possible about Ms. Simon's past, including her relationship, health history, and stress at work. As a result, the therapist could better comprehend the causes of Simone's anxiety illness. The therapist used the thought records technique during the CBT section to find Simone's worried thoughts about work deadlines and confront them. They assisted Simone in realizing the irrationality of her perfectionistic ideas by guiding her through the process of weighing the evidence for and against them. As a result, she can begin having more sensible alternate thoughts, lessening her anxiety. The therapist used CBT with motivational interview approaches to increase Simeon's drive and commitment to change. The therapist might ensure Simone actively participated in treatment by asking if she was ready to learn how to manage her anxiety better. Several therapeutic interventions were used to integrate psychotherapy approaches, including teaching realization technique, collecting personal dynamics, and analyzing underlying emotional concern. Ms. Simone received additional assistance from these methods in managing her anxiety symptoms. Given that the patient responded well to the therapy, it can be assumed that the interview successfully fostered awareness, confronted unhealthy thought pattern, and armed Simone with practical coping mechanism. Therefore, continuous therapy and follow-up sections are likely required to maintain improvement and address any new issues that may surface. And with that, that comes to the end. You can review my references. I have